Hello, my spooky dudes, and welcome to Spooky RX. My name is Ari, and this is RX Study. So, what we're going to be doing is Pioglitazone ACTOS. Mechanism of action. So, this medication is a thiazolidinedione. It is dependent upon the presence of insulin. That means that this drug cannot be used in type 1 diabetics. They are not able to produce insulin, only in type 2 diabetic patients. It does decrease insulin resistance in the periphery and in the liver, resulting in an increased insulin dependent glucose disposal and decreased hepatic glucose output. This is how it works. It is not an insulin secretagogue, and it is an agonist of PPAR gamma. All right, dosing. So initial dosing for this is going to be 15 milligrams to 30 milligrams, depending on your patient, and it's going to be dosed daily. This medication also is going to be increased by 15 milligrams increments, usually depending on your patient, every 2 to 4 weeks, depending on how your clinic does it. It's also dependent on their hemoglobin A1C and their goals. So blood sugar readings, hemoglobin A1C, there's a lot that kind of goes into that. And the max dosing on this one is going to be 45 milligrams. Usually comes in a round tablet. You see a white tablet. And just to note, if a patient has NYHA heart failure class 1 or 2, they can start on this medication, but we do want to start them lower at about 15 milligrams. Side effects. So side effects for this drug include edema, bladder cancer, fractures, hepatic effects, and upper respiratory tract infections. Box warning, big box warning, congestive heart failure. I know in the previous slide we had stated, yes, patients can be on this with NYHA class 1 and 2. However, class 3 and 4 is absolutely not recommended. And that brings us to the next slide. Contraindications for this medication. So contraindicated in NYHA class 3 for heart failure. So do not give it to these patients. Do not start it in these patients. And if these patients have this while on this medication, then definitely want to consider discontinuation of the medication. Also, just to note for drug interactions, the metabolism of this medication is through the CYP2C8. So any inhibitors or inducers of this medication can interact with this, or of this enzyme can interact with this medication. Clinical pearls. So administration is usually without regard to food. The monitoring parameters on this medication is going to be signs and symptoms of worsening heart failure. So we're looking out for those signs of worsening heart failure: edema, weight gain that is greater than 2 pounds in a single day, greater than 5 pounds within a week, along with edema, shortness of breath, those type of things. We're going to watch for those kind of signs. We're also looking at LFTs, since this can affect the liver, and blood glucose, obviously. And then type 2 diabetic A1C reduction, just a good thing to note, something I learned while I was in residency. Very important when you're comparing these medications and deciding what to dose your patients on, is looking at the A1C percent reduction. So here, actually pretty good 0.98% reduction, but that does mean we need to get that patient to the 45 milligram dosing. So keep that in mind. A patient does need to be titrated all the way up in order to get that much A1C reduction. We do see A1C reduction in the lower strengths, but definitely not nearly as much. And then counseling points. So always with our diabetic patients and they're on these medications, we want to make sure that we are counseling on hypoglycemia signs and symptoms. I'm going to make a video on hypoglycemia signs and symptoms specifically. We can go into that. And then blood glucose goals. And again, I will make a video just kind of talking about those blood glucose goals and those based on ADA guidelines and etc. All right, well, that kind of wraps it up for today. Thanks for watching.